Hello, my name is Jennifer. I will be talking today in regards to a life or death crisis, which is healthcare in America. So or imagine having to choose to pay rent or to afford your medication. Unfortunately, that is something that most Americans go through in America. Um, this is the ugly truth, unfortunately. Imagine needing a vial of insulin, which typically costs $10 for the manufacturer to make. However, they sell it for $300. Do you think that's fair? According to the American Diabetes Association in 2022, over 7 million Americans rely on insulin. Yet, one fourth of it can technically afford it. Now, cancer medications, it's over $10,000 a month, which is absurd, making that a treatment, and it's making it impossible for many people to live on it. Like, there's most insurance that do not even cover it. As well, there is insurances that cover it, but you have a high deductible or a high payment, which is not beneficial for us, the Americans. Now, if we were comparing this to Europe, they see the medication, healthcare, medical as a human right, not necessarily how United States or America sees it, which they see it more as a profit. Now, it's outrageous, the cost of essential medications in the US, which this is preventing many people from accessing it. When there's a community involved and pressure placed, there's more strength and opportunity for change. This can help save many lives. Now, we need to take the example and we need to further investigate and see how we can either be like them or better them in regards to Europe, where they prioritize their human health care, their human rights as health care, and they gain access to regulation and universal coverage. So this is something that we should technically be looking at, so it can be very beneficial for us all. Now, we need to save more than anything our patients. Our healthcare system is not what many think. Many of these medications, chemos, insulin, which are so expensive, are very inaccessible for all. There's too much demand for it as well. According to Kaiser Family Foundation in 2023, American pays more for prescription drug than anyone else in the world. So some patients prefer to delay a dose, skip a dose, or not even, or take half of it to last the medication longer. Now, a study in Health Affairs in 2022 found 30% of cancer patients skip or delay care because of the cost. That is totally unfair and unacceptable for us to be living that way, and many Americans going through that. In Europe, you do not hear somebody going bankrupt or somebody paying for this or for that. As to in America, there's many Americans that go bankrupt due to medical bills. Now, this is something that has been going on for many years, and you may ask, how can we fix this issue? Well, and how come Europe hasn't encountered this issue? Think about that for a moment. So we do need legislation that puts patients prior before profits, not vice versa. We need to support federal legislation like the Affordable Insulin Act, which that is something that caps the insulin cost at $35 a month, which is super helpful for many patients. We need to donate, or volunteer for nonprofit organizations like Cancer Care that help patients afford their medication. And we also need to contact lawmakers and demand assistance for affording medication, especially from pharmaceutical companies. There are like manufacturer coupons that can help the patient as well lower their copay, but it's something that all of us in all have to do. We need to seek better healthcare, better medical for us. That way we can continue to care. The average age for Americans is about 70, 65, 70. Whether Europe, it's over 80. Now that's something that we need to take accountability, and we need to act before it's too late. We need to be like them in regards to the medical and health care. These are a few ways we can help fix the issue that is literally killing people who cannot afford medical pharmaceutical experiences.